Can you have a hair transplant at a younger age, for example, 19, 20 or 21 years of age? Well, here's my take. If you're suffering from androgenetic alopecia, that means if baldness runs in your family and you find yourself having baldness at an early stage, which is of a higher degree, and you see that there's a lot of temporal hollowing, the crown area is getting bald, and you want a correction and you want more hair on your scalp, then what is the right option? Is it hair transplant or is it conservative measures like GFC or PRP, medications, lotions? What should you opt for? In my opinion, if you have an advanced degree of baldness at a younger age, then you should opt for a hair transplant for a complete transformation of your look if that is what you desire. However, if you just desire to maintain some decent hair on your scalp, then you can go for conservative measures. How different are the two? If you're looking for conservative methods like oral medications, lotions, some sessions of PRP, GFC, then you can have them done routinely to maintain the hair on your scalp. But after a while, all these will have their limitations of results. That is why if you opt for a hair transplant at a younger age, the kind of volume that you see with hair transplant is not possible with these conservative measures. If you're facing generalized thinning of hair and you have an environmental cause to point out to, then the medical methods are okay for you and you can go ahead with that. However, if you are facing typical androgenic alopecia like temporal hollowing, hollowing around the crown, in general frontal hair loss, if all this is what is bothering you and you want quite a good volume on your scalp, then definitely my choice always would be a hair transplant. The reason that I am advocating hair transplant at a younger age is that the maintenance is quite less. If you go for the medical method, then the maintenance can be long drawn and you will after some years find yourself still having bald patches and you would still want to do something about it. If you do a hair transplant at a younger age, then this complete transformation changes your entire look and you can choose to maintain it with very minimal efforts over the course of few years or the next maybe 10 years, and after a decade if you see that your baldness is advancing, then you can always opt for a second hair transplant or you can opt for medical methods to maintain your hair. I'll tell you another very strong reason why I advocate hair transplant for younger people is that when you face a severe degree or even an advanced degree of baldness in your younger age, you resort to using hair patches to maintain your look. And that is very unhealthy. These hair patches use glue to have hair on your scalp, then you can have ring alopecia, the scalp skin goes for a toss, the existing hairs, they also start to get weaker and eventually you start having an even greater degree of baldness than you would be having if you didn't use a hair patch. So obviously there are very strong reasons why you should consider hair transplant at a younger age if you need a complete transformation of your look and if you're facing advanced baldness. So this was my take about having a hair transplant at a younger age. Of course, you are free to take sessions of GFC or PRP or medications and lotions nonetheless. And if you find yourself stuck, then you can opt for a hair transplant at any time. So do you also feel that these conservative methods like PRP injections have not worked for you and you would still want a solution? Do let me know in the comment box below. So if you have a young friend who's using hair patch to hide his baldness, then you have to forward this video to him. Hope you found this information useful. You are free to comment on the video and I shall be very happy to answer them. Do follow our channel as the Trichology because we keep posting very interesting information about hair on this channel. Thanks for watching.